In these cases, we give intraocular injections. In constricted, you can give intracameral adrenaline to dilate the pupil on the table. And the other one is intravitreal injection. That means the injection drug is given into the vitreous cavity. That means these intravitreal injections are given to control the severe forms of infections like cytomegalovirus retinitis, endophthalmitis, acute endophthalmitis, chronic uveitis, and in case of some to treat some diabetic retinopathy cells. In intravitreal injections, vitreous implants can be used to deliver the ganciclovir, the treatment of cytomegalovirus retinitis, and fluocinolone for treating chronic uveitis. This is the picture showing various routes of local ocular drug delivery. These are all invasive procedures because we are puncturing the globe with needle. There is every chance of getting retinal detachment. Suppose if injection is not given in the proper way, there will be every chance of getting retinal detachment. And this is giving injection while doing cataract surgery. We can give adrenal intracamerally. Camerally means injection into the anterior chamber. This is the thing. This is the space, and this is vitreous space. And this one is topical. That means topical means by using only conjunctival installation of drug into the conjunctival side. And this the last one is a systemic administration. We can give some drugs systemically also, either orally or intramuscular injections, intravenous injections, like chloramphenicol and sulfonamides. And then coming to the common ocular therapeutics, commonly used drugs in the ophthalmological practice. One is antibacterial agents, antiviral agents, antifungal agents, corticosteroids, non-steroid anti-inflammatory drugs. These in this list, there is no not mentioned. Other drugs also are there, anti-glaucoma drugs and mediatic drugs and tear substitutes also. They are used to treat the dry eye. The antibacterial drugs agents are mainly penicillins. Bactericidal agents act by interfering with the cell wall senses. They are confined to gram-positive organisms of foci. Hypersensitive to penicillin should be checked before giving the drug. And deep-seated inflammations of the orbit or lids, the drug should be given parenterally. Superficial inflammation of the conjunctiva and cornea, locally it can be given as drops or ointment, in the form of drops or ointment. And penicillin is effective. Penicillins are effective against focal and bacillus, gram-positive bacilli in foci. Is given in the form of benzyl penicillin and penicillin B and sodium oxacillin. For penicillin resistant bacteria, we can give cloxacillin sodium and flucloxacillin. And also for penicillin resistant staphylococci also it is used. And broad spectrum penicillins are again ampicillin and amoxicillin. Nowadays we are not using this much in practice. Ampicillin, amoxicillin, carbenicillin, tricarcillin, and etelocillin. They act against the pseudomonas infections. Next, other one is a cephalosporins. This is also bactericidal, similar to penicillin, relatively resistant to staphylococcal penicillins. First generation, they are narrow spectrum, second generation, and third generation. And first generation are active against the gram-positive foci. Sapazolin is given IM or intravenously, 0.5 grams intramuscularly 8 hourly. And third generation of the wide spectrum, effective against the gram-negative and but not against the staphylococcus. Okay, to treat the pseudomonas infections, it can be given 1 to 2 grams intramuscularly or intravenously every 8 to 12 hours. But there will be side effect will be retinotoxicity. Side effects will be allergic reactions to penicillin type, thrombocytopenia, neutropenia, and nephrotoxicity. Then aminoglycosides. These are autotoxic. This is also a broad spectrum antibiotic, bactericidal, and primarily act against the gram-negative organisms mainly. Streptomycin is given to treat the tuberculosis, and gentamicin in cases of acute infections like pseudomonas. They are given in dosage of 1 to 1.5 milligram per kg intramuscularly 8 hours. This is a nephrotoxic, therefore the dose is calculated according to the body weight and renal function of the individual. It can be given topically also in the form of 0.3% eye drops, and it can be given subcutaneous route also. Then other one is the tobramycin. It's given 2 to 4 times more. It is 2 to 4 times more effective against Pseudomonas aeruginosa and Proteus infections, given in the form of 1% eye drops. Tobramycin. And the next one is the amic acid. It is effective against many gram-positive and negative organisms. To treat the endophthalmitis, 0.4 milligrams is injected intravitreally along with the vancomycin. And the other one is soframycin, neomycin, cizomycin, and netilmycin. These are all available as in the form of ointments. And the side effects of the aminoglycosides, they provoke allergy, and they may provoke allergy and bacterial resistance. And other side effect is it is known to cause autotoxicity and nephrotoxicity. These are too toxic for systemic use and hence used only topically. And the other one is the next one, the tetracyclines. It is a broad spectrum bacteriostatic, active against both gram positive and negative organisms as well as some fungi like rickets fungi and rickets chlamydia. Tetracyclines is only mostly used to treat chlamydiasis, trachoma cases, chlamydial infections. Tetracyclines, chlorotetracycline, and available as in the form of chlorotetracycline and oxytetracycline, administered essentially in the form of drops or ointment for the trachoma. And chloramphenicol is used topically as 5% eye drops. Then acrolites and lincomycin group. These are effective against gram-positive infections and those due to chlamydial and toxoplasma gondii infection. To treat the toxoplasma gondii also. That is a protozoan. To treat the protozoal infections also. And the other one is the erythromycin, azithromycin. Azithromycin nowadays is mainly used to treat mebominitis, to treat the mebominitis gland infections. It can be given orally by single statin dose of 500 to 1500 milligrams in the treatment of trachoma, toxoplasmosis, and Lyme disease. And the other drugs are lincomycin and clindamycin. Then the glycopeptides. These are vancomycin. This is effective against all gram-positive and resistant Staphylococcus aureus and epidermatitis. Drug of choice in endophthalmitis. It is used in endophthalmitis along with amic acid or ceftazidime. 1 milligram in 0.1 ml in intravitreally. The toxicity is topical. It may become it may be toxic when it is given topically or subcutaneously. So we should use the drug cautiously. Then another one nowadays most widely used are chloroquinolines. These chloroquinoline group of drugs are used most widely. These are the derivatives of nalidixic acid having broad spectrum antibacterial activity. These are bacterial drugs inhibiting bacterial DNA synthesis. First generation is ciprofloxacin and norfloxacin. Second generation is ofloxacin, lomefloxacin, rifloxacin. Third one is parfloxacin. Fourth is gatifloxacin, moxifloxacin. Nowadays we are using ofloxacin most widely, gatifloxacin and fourth generation moxifloxacin and gatifloxacin are most widely used. And then coming to the antiviral drugs. These antiviral drugs are effective by causing by causing a disturbance to synthesize DNA in the virus. Most commonly, the most commonest viral infection we will get. We'll see in the ophthalmological practice herpes simplex virus infections. The herpes simplex virus, first one, the most commonly used drugs are idoxuridine, vidarabine, trifluridine, acyclovir, famciclovir. For herpes zoster virus infection, we can use acyclovir, famciclovir, valacyclovir, vidarabine, sarudine. And to treat the CMV, cytomegalovirus retinitis, we can give anciclovir, foscarnet, zidovudine. And non-selective antiviral drugs are interferons and immunoglobulins. Coming to the pyrimidine derivatives of the antiviral drugs. These are the idoxuridine derivatives, halogenated pyrimidine, thymidine structure. In case of acute epithelial herpetic keratitis, it is given in the form of 0.1% eye drops every 1 to 2 hours and 0.5% ointment in the night. Toxic reactions are it may cause follicular conjunctivitis, superficial punctate keratitis, and punctal occlusion. It is not used after keratoplasty because it's known to inhibit the corneal stromal healing. Other one is a trifluorothymidine, TF3, otherwise called TF3. It has high solubility, greater potency, lack of toxicity when compared to the idoxuridine and allergic reactions. It is effective in idoxuridine resistant cases. It is used as 1% eye drops 5 times a day for healing of 90% herpetic ulcers in 2 weeks. So the drug should be given at least for 2 weeks. Then purine derivatives. In this group, adenine arabinoside or vidarabine drug is effective against the herpes simplex virus, cytomegalovirus, vaccinia, and zoster viruses. This is more potent and less toxic than the idoxuridine. It is available as 3% eye ointment and should be used 5 times a day till epithelialization of the ulcer occurs. That means you should observe while giving the drug, you should observe while the ulcer is regressing or not. Another most common one is the acyclovir. This is extremely safe and effective in most forms of the herpes simplex and herpes zoster virus infections. It inhibits the DNA synthesis, preferentially in the affected cells. In case of epithelial and stromal herpes simplex keratitis, it is used as 3% eye ointment 5 times a day. To treat herpes simplex infections, acute infections, 400 milligrams orally, and it should be given orally also. Topically, we should give the herpes in the form of ointments, and orally it should be given. In case of simplex infections, orally the dosage is 400 milligrams 5 times a day for 5 to 7 days. To treat the herpes zoster ophthalmicus, the dosage should be doubled. That means 800 milligrams orally 5 times a day for 7 to 10 days. Or otherwise, it should be started within 72 hours of attack of the virus. It is also effective against the Epstein-Barr virus and cytomegalovirus infections. That means we can give this acyclovir for treating Epstein-Barr virus and cytomegalovirus. And medication, idoxuridine is used in the form of 1% drops or 0.5% ointment. where triflucaridine TF3 is used in the form of 1% drops. Ignin arabinoside is used in 3% ointment. Acyclovir is available as 3% ointment. Then coming to the antifungal agents. The main groups of antifungal agents are polyene antifungals, imidazoles, pyridines, silver compounds. There are 4 groups. Then coming to the polyene antifungals, which are isolated from various species of Streptomyces. It is a large conjugated double bond system in lactose ring linked to an amino acid sugar. It acts by binding to the sterile groups in the fungal cell membranes and introduces to the fungal cell wall synthesis, rendering them permeable to the drug. And in this group, amphotericin B is the most widely available. It is used to treat keratomycosis, metastatic and exogenous endophthalmitis. It is available in the form of 0.1% or 0.25% drops or 2.5% ointment. It can be given a dose in the dosage of 5 to 10 mg per kg body weight 5 to 10 mg intravitreally in the form of intravitreal injection and intravenously also in the concentration of 1.1 milligram per ml, 5% dextrose for infections caused by Candida, Histoplasma, Cryptococcus and Aspergillus. And the other one is Nystatin. This is widely used to treat the Candida albicans infection, the other fungal infections also. It is available as a 3.5% ointment. And the other one is the natamycin. This is most widely used, otherwise called pimarcin, natamate titers. It is available in 5% suspension. It is used to treat Candida albicans, Aspergillus, Fusarium and Cephalosporium. It is applied every hourly and then tapered off as the infection subsides. It is used to treat the fungal corneal ulcers. And coming to the imidazole group of antifungal drugs, these have complex mechanism of action against the fungal cell by causing the changes in the permeability of the fungal cell membrane by blocking the production of ergosterol. It is also effective against the bacteria and acanthamoeba. Acanthamoeba is protozoan to treat the protozoal infection of the eye. That is a type of amoeba causing protozoal infection affecting the eye, acanthamoeba. And first one is in this group, niconazole. It is effective against the yeast and filamentous fungi. It is available in the form of 1% eye drops. Should be given hourly, and ointment 2% ointment every 6th hourly. Drops should be given hourly, 1%. It is available in the concentration of 1%. Ointment is in the concentration of 2%. Should be given 6th hourly. And the other one is ketoconazole. It is effective against the Candida. It is used in case of fungal endophthalmitis, adnexal, or severe corneal infections. Given orally, 200 to 800 milligrams daily. And fluconazole. Fluconazole is effective against the Candida and the cryptococcal infections. It is used on the oral route. Should be given 100 to 200 milligrams every 6th hourly. Other available drugs are itraconazole, clotrimazole, iconazole. The pyridine group, in this group, flucytosine, it is a fluorinated salt of pyrimidine. Silver compounds. The combination of silver with sulfonamides and with other antimicrobial compounds significantly increases the activity against the bacteria and fungal infections. Silver sulfadiazine is most widely used and highly effective against the Aspergillus and Fusarium species. Then the most commonly used drugs in the ophthalmological practice is steroids. These corticosteroids compounds are secreted by our body by adrenal cortex. These have potent anti-inflammatory and anti-allergic and anti-fibrotic action. It is most widely used in the ophthalmological practice due to their potent anti-inflammatory, anti-allergic and anti-fibrotic actions. Because in case of eye, the inflammatory reaction itself will cause more damage to the eye structures. So we should give anti-inflammatory drugs. Most widely used anti-inflammatory drug is corticosteroids. The available topical preparations of the steroids, corticosteroids are it is used to treat the uveitis, scleritis, allergic conjunctivitis, allergic keratitis, cystoid macular edema in case of diabetes, and after intraocular surgery. Cortisone is available in the form of 0.5% and 1.5% ointment, 0.5% suspension. Most widely used is prednisolone. Hydrocortisone is available as 0.5% suspension and 0.2% solution. And dexamethasone is 0.1% solution and sodium phosphate 0.5% ointment. Betamethasone is available in the form of 0.1% solution and as a sodium phosphate molecule 0.1% ointment. Medricin is 1% suspension. Fluoromethalone is available as 1.1% suspension. Loteprednol is also used, is widely used to treat low-grade inflammatory reactions, inflammatory conditions like chronic allergic conjunctivitis and scleritis. Mild cases, mild inflammatory reactions, we can use loteprednol. This is available in the form of 0.5% suspension. And coming to the systemic preparation of the corticosteroids. Systemically, we use steroids to treat posterior uveitis, sympathetic ophthalmitis, Vogt-Koyanagi-Arada syndrome, papillitis, anterior ischemic optic neuritis. In these conditions, there will be these are all acute conditions. So we should treat them with systemic corticosteroids also. This prednisolone is available as 5 mg, 10 mg tablets and solution for injection in strength of 20 mg per ml. Dexamethasone is available as 0.5 mg tablet and a solution for injection in the strength of 4 mg per ml. Prednisolone is given by calculating the dosage as 1 milligram per kg body weight. And betamethasone is available as 0.5 milligrams and 1 milligram tablets. And side effects of these corticosteroids, as usual, these are having more side effects. Injudicious use of steroids can cause glaucoma, cataract formation, and ptosis. These misuse causes more ocular and systemic side effects also. Systemic side effects are like raised blood sugar, diabetic condition. So before putting the patient on the steroids, we should exclude the glycemic status of the patient. We should see whether he is diabetic or not. And it will also cause hypocalcemia. So we should substitute with calcium. Well, suppose the patient is put on steroids, like systemic steroids, like prednisolone, should substantiate the calcium also. Should give calcium also. And to prevent gastric ulcers, we should give antacids like pantoprazole. And patient is advised to take the medication after having full meals. Then other non-steroidal anti-inflammatory drugs. There are more varieties, heterogeneous group of anti-inflammatory, analgesic and antipyretic compounds. These act by inhibiting cyclooxygenase pathway for prostaglandin synthesis. And Systemically, we can use the salicylates like aspirin, pyrozoline, derivatives like phenylbutazone. Nowadays, we are not using oxybenzone. These are all banned. Paraminophenol derivatives, acetaminophen. Indole derivatives like indomethacin. Propionic acid derivatives like ibuprofen, naproxen, flurbiprofen. Anthranilic acid derivatives are mefenamic acid. Newer drugs are ketorolac and diclofenac. And coming to topical use, only topically we will give these anti-inflammatory, non-steroidal anti-inflammatory drugs. These are indomethacin. It is available in the form of 0.1% suspension, and other one is flurbiprofen, is available as 0.3% drops. Diclofenac sodium is available in the form of 0.1% drops, and ketorolac is available 0.5% drops. These are all indicated to treat some conditions like episcleritis and scleritis. We can give oxybenzone or indomethacin orally also, but we use only mostly topical medication. To treat uveitis, in case of long-term therapy of recurrent anterior uveitis. To treat the cystoid macular edema, 0.03 flurbiprofen eye drops started 2 days pre-operatively and continued for 6 to 8 weeks post-operatively to prevent post-operative cystoid macular edema. Pre-operatively, to maintain dilatation of the pupil, flurbiprofen is used every 5 minutes to 2 hours during extracapsular cataract surgery, cataract extraction with or without IOL implantation. ECCE surgery, that is conventional surgery. And to treat spring catarrh, in this to treat the viral, allergic conjunctivitis or spring catarrh, sodium chromoglycate is used as 2% solution. I think.